Today's topic, natural solutions for diabetic neuropathy and neuropathy. And our very special guest is Terry Lemerond. Terry Lemerond is a retailer, author, educator, and entrepreneur who has been in the natural products industry for more than 45 years. Over 400 nutritional and botanical formulas were developed by him, and they continue to be top-selling products in the market today. He has a personal website dedicated to health and nutrition education available at www.terrytalksnutrition.com. And so now I introduce to you Terry Lemerond. Welcome, Terry.
And thank you, Cheryl. Thank you very much, and greetings to everyone out there. We're going to have a very interesting subject today because this is becoming an epidemic where so many people today are struggling with neuropathy. And we have some very interesting and natural solutions that may help people that are struggling with this very common condition today. And you can almost tell when people have this condition. When I'm out shopping in a health food store, and I watch people come in the store, and I see them shuffling, almost dragging their feet, and I know they probably have neuropathy. Their feet are numb, they're burning, they are filled with like pins and needles, because there's so much nerve damage, which is usually very painful, causing the signs and symptoms of the pains and needles. And some of these causes are, of course, the lifestyle that we have. Lifestyle and our diet cause almost all of our current diseases today. It's also caused by insulin resistance because of the amount of sugar we are consuming. High rates of neuropathy in diabetics, though symptoms may be delayed, it may take 10 or 20 years after diagnosis. Many of our conditions, even cancer, may take 20, 30, 40 years to come to the point where it's diagnosed. High levels of nerve irritation and inflammation. Peripheral neuropathy, one of the most common types, usually affects the hands and the feet. Therefore, there's weakness, numbness, tingling, and pain. Sometimes people wake up through the night and have to shake their arms and fingers and their hands in order to get rid of the nerve numbness. Smoking is another very high risk factor because it does so much damage to our peripheral nerves and our arteries as well. And it's often associated with diabetes. But I see many people today say, well, I have pains in my fingers and toes. I have these sensations of pins and needles, but I'm not a diabetic. Well, this is a pre-diabetic sign. And it isn't going to be too long after that where they will have a full-blown case of diabetes. About 60 to 70% of diabetic patients have neuropathy. So it's a very, very common problem. And why? High blood sugar. How much sugar are Americans eating today? Oh, my gosh. We've seen the toxic effects of sugar. We have scientists now out there talking about the damage that sugar is doing to the human body. And we have gone from the early 1900s where we were consuming about 6 to 8 pounds of sugar per year per individual, where we are today, we are consuming around 250 pounds of sugar per year per individual. And I know you always say, I hear it all the time, well, Terry, I don't have a sugar bowl at home anymore. I don't even buy very much sugar. Well, thanks to the food manufacturing companies and those that are serving these big 20-ounce soda drinks, they are using, well, in fact, the 20-ounce soda has about 48 teaspoons of sugar. We are drinking the sugar. We are eating the sugar without us even knowing the fact. And sugar has a tremendous irritating effect on our nervous system. So what's important? Making sure you're keeping blood sugar levels down can prevent nerve damage. That's the bottom line. It's sugar, sugar, sugar. Once the damage has occurred, it is very difficult to reverse. So take care of yourself now. Change your diet now. Change your lifestyle now. And the earlier you take action, the better results will be. So here are some complications of diabetic neuropathy. Listen, folks, these are complications. You know, the doctor doesn't keep us healthy. No professional keeps us healthy. No drugs keeps us healthy. Now, drugs may save lives, and they may make our life a little bit more easy to contend with, but they're not health promoting. Well, Terry, what is health promoting? Our diet, our lifestyle choices. You know, you and I are responsible for our health. We don't go through life doing what we want to do and what we enjoy to do and what we have pleasure in taking part of, desserts, sugar, soft drinks, fast food. All of these things are taking a toll, and then we go to the doctor, and then we are placed on drugs, and many are on 5, 6 prescription drugs. So people that have these complications should be aware of these early so that they can stop the sugarholic, the carbohydrate holic, I should say. So people with neuropathy have 5 times increased risk of falling. And almost 90% of diabetic foot ulcers are associated with diabetic neuropathy. These are complications. And conventional treatments of neuropathy. Here's what happens when you go to a physician and you say, I have these pins and needles. They're going to say, okay, you have neuropathy. Well, there are prescription drugs available to treat diabetic neuropathy, but they don't repair the delicate blood vessels and nerve endings, plus they have their own set of side effects. You know, many drugs, it's amazing the drugs that people take and don't think of what those are doing in terms of side effects. We're going to end up with side effects that we may need another drug to contend with the side effects of the first drug we have been placed on. So the range, and these drugs range from antidepressants, anti-seizure medications, pain relievers, anti-nausea medications, and they are not proven to be effective. But that's all they have. That's their toolbox. And the toolbox isn't very effective, and it also has a range of side effects. But there are easy ways and natural solutions of easing painful nerves. And you really want to address 3 areas. Circulation. That means proper blood flow that carries nutrients and oxygen to the nerves. We have to feed the nerves, just like we feed the brain, feed the heart, and feed all of our other functions of our body. Inflammation. We know inflammation plays a huge part of almost all of our diseases. In fact, you could say 98% of our diseases has an underlying factor called inflammation. It plays a significant role in the development and progression of nerve damage. And then repairing of the nerves and the nerve sheath, the myelin, promotes nerve repair, pain relief with a combination of bioactive. Now, this is a very important word, bioactive B vitamins, and I'll explain that in a minute, zinc, chromium, and alpha-lipoic acid. These are very, very important factors that we need to look at in order to be healthy. Bioactive. What does bioactive mean? And that is the preferred form of B vitamins. When we take in B vitamins, those B vitamins have to go through the liver and have to be converted into the biologically active form of B vitamins. And many people don't convert the B vitamins into the biologically active form. So we want to make sure that we take internally the B vitamins that are already converted into the bioactive form. That's the preferred form. That's how our body uses it immediately, goes directly to work. And it's estimated that 30 to 50% of the population have difficulties converting the B vitamins into their bioactive form. So they're wasted, and they're not going to do you any good to support the nervous system. Higher levels of people with diabetes are poor converters. Patients with high blood sugar often are deficient in vitamin B6, and when given the active form, the P5P form, the blood glucose reduces in just 7 days. And up to 15% of individuals over 60 are deficient in vitamin B12. So we need more B vitamins and more of the bioactive B vitamins. And these are some of the benefits of the bioactive B vitamins. No liver conversion. As I said earlier, we have to have these regular B vitamins go through the liver to be converted into the biologically active form, the bioactive form. The bioactive form needs no liver conversion. It increases nitric oxide, which expands blood vessels and circulation. It reduces nerve pain and allows nerve healing to occur naturally. So these are all beneficial for us in order to improve the benefits of the bioactive forms. Many people are deficient in B vitamins. There's no question that they're very deficient in the B vitamins. So we need to correct that as best as we possibly can. I'm running into a problem.
Well, we'll pause for just a moment to address these technical difficulties, and we'll be able to restart this educational program in just a moment. Are the slides not moving, Terry?
No, they weren't. And my friends, here's what to look for. If you're looking for the bioactive form of B vitamins, vitamin B12 is known as methylcobalamin. It is the most effective form of treating nerve damage, nerve pain, and essential for nerve repair and regeneration. Shown in clinical trials to ease nerve pain, tingling, and burning association with neuropathy. Vitamin B6, known as P5P, reduces nerve pain, shown to prevent progression of nerve damage associated with diabetes. And folate, not folic acid, but folate, and the preferred form methylfolate, reduces homocysteine. Homocysteine interferes with nitric oxide activity, contracts the vessels rather than allowing them to expand. And this specific combination shown in clinical trials to significantly reduce nerve pain. Combined with other B vitamins, of course, you want to get the whole package for best results. Thiamine, riboflavin, or vitamin B1, vitamin B2, biotin, niacin, pentazetic acid. They're all beneficial. And you know the drug that is prescribed for diabetes, metformin, the diabetic medication, can also interfere with some of these B vitamins, such as folate. So you really want to make that kind of difference by taking the preferred form, the active form. Now here's a special nutrient that has been used in Europe and particularly in Germany for regulating blood sugar levels, alpha-lipoic acid. It's an antioxidant that is very special because it actually works on both the fat and water-soluble nutrients, compounds, shown to lower blood sugar levels in people with diabetes, and regularly used in Germany to treat diabetic neuropathy, proven in clinical trials to reduce symptoms of neuropathy and slow its progression. Can boost levels of glutathione, which helps to protect nerves from oxidative damage, normalizes intake of blood sugar by the muscles, and helps reduce painful neuropathy. Benfotiamine. This is a very special form of vitamin B1. You know, vitamin B1 is water-soluble. All the B vitamins are water-soluble. So they're washed out of the body very quickly. You consume them within 3 or 4 hours, they're washed out of the body. They have to be taken every day to make sure that we replenish our B vitamins. But now this is a fat-soluble form of vitamin B1, thiamine. And because of that, it can achieve 5 times the concentration in the body compared to the water-based or water-soluble thiamine or B1. It prevents glucose toxicity and brings elevated blood sugar levels back to normal. Clinically proven to reduce pain and complications of neuropathy. When you're trying to prevent and trying to reverse neuropathy, we have given you some very good clues, such as the B vitamins, alpha-lipoic acid, but there's also additional support. Diabetes is frequently associated with low levels of zinc and chromium, and they're both essential for sugar metabolism, and that's why we want to try to include these 2 minerals along with B vitamins and the alpha-lipoic acid. Chromium, for example, is an essential trace mineral. We need it every day. Prevents the buildup of glucose in the bloodstream by increasing the efficacy of insulin. In a clinical study, a clinical trial, individuals taking chromium reduced their fasting blood sugar levels from an average of 197 to 103 in just 3 months. You know, we can recover our health very easily if we start doing some of the right things with the right nutrition, the right supplements, and also making some changes, of course, in our diet, and that is to avoid sugar and refined carbohydrates, and maybe overall lower the carbohydrates. Zinc, not an easily obtained mineral because all of our soil has been, you know, it's been washed away. We don't replenish minerals in our soil. We use artificial fertilizer. So we're losing our minerals in the soil, and without minerals in the soil, the plants can't gather up the minerals, and we eat the plants that are actually, have lost their mineral content as well. But zinc improves blood sugar control, promotes tissue and wound healing, stabilizes pancreatic storage of insulin, inhibits oxidative stress that promotes insulin resistance and diabetes, and one of my favorite herbs from India, Boswellia. And why? Because it is one of nature's most powerful anti-inflammatory medicines. And it does what no other drug can do today. It inhibits the 5-lux pathway, and it's been standardized for AKBA, which is the active component of Boswellia, which is very, very important. So this is extremely beneficial for, like, this combination. If we could find a combination of the B vitamins, the bioactive B vitamins, alpha-lipoic acid, Boswellia, zinc, and chromium, this would be a really nice package to support our blood sugar levels. And here is the canary. You know the story of the canary? They actually had cages of canaries down in the mines. And if the canary died, there was also a condition that would affect the miners. Why? Because the oxygen was being lost in the mines, and this would affect, first of all, it affected the canary. That was their way of determining whether or not there was enough oxygen in the mine. So it's like whether you have diabetes or prediabetes, neuropathy is a signal that damage is occurring inside your body. It's that simple. Some people say, well, I have numbing and tingling in my feet, but I don't have diabetes. Well, it's not going to be too long after you will have diabetes if you continue the same way you are eating and living your lifestyle. So here's something that we've learned over, well, we do a lot of research. And we try to bring this research to you so that you have evidence of it. We know that you don't have the time, you have families to take care of, you have your job to take care of, and we'd like to bring all this information to you so that you don't have to do going through the internet looking for how you possibly can reduce some of your blood sugar and blood sugar levels and even A1C. So we ran across an herb that is very, very interesting, and there's over 60 years of research in Germany. It's called Hintonia lactiflora. Hintonia, Hintonia. And you should really consider this herb to be your daily routine go-to herb for healthier blood sugar levels. And why? Because there have been a number of good studies out of Germany over the last 60 years that shows Hintonia lowers A1C levels by 10%, improving the fasting blood sugar levels before eating and after eating by 23 and 24%, respectively, balance the blood cholesterol, prevent reactive hypoglycemia, and reduce medication use. All this by using Hintonia, a natural herb that has no side effects. And mesoglycan. Now, that's probably a word you've never heard. You probably have never been associated with mesoglycan. Well, it's a very natural substance within our body, although we can add more of it to our diet to nourish our blood vessels. Our nerves are fed by some of the smallest blood vessels in our body. So it's important to keep our blood vessels flexible and strong. Damage to the blood vessels that feed the nerves, which causes a decrease in blood flow, can contribute to diabetic neuropathy. Circulation is a key to keeping our nerves healthy and our heart. Mesoglycan can do what drugs can't do. Actually, mesoglycan can repair and rebuild blood vessels, increasing flexibility, elasticity to the blood vessels, and keeping blood flowing. It's like a traffic management, because when you have traffic cops out there, they keep the flow of traffic. And mesoglycan keeps blood cells from collecting in bunches, like cars collect in bunches when nobody's paying attention to the management, so everything can flow smoothly. Also, it does road repair. It provides the materials needed for the body to repair damaged blood vessels.